Welcome back to the Modern Metabolic Health Podcast. Today, I have a very special guest, Dr. Brianna Bingham. She is the newest addition to Missouri Metabolic Health. So I'm so excited to have her on today to tell us about herself, about obesity medicine, and I know we're going to learn some from her. So thank you for being here today, Dr. Brianna.
Thank you so much. Thanks for having me.
Yeah, so like I said, I would love if we could just start by you telling a little bit about yourself.
Yeah, for sure. So, Brianna Bingham, I am from Springfield, Missouri originally. I'm in the Kansas City area now. I am an internal medicine board certified physician. Went to med school here in Kansas City, did residency at KU, and now I work at a full time at a senior primary care center, but I'm working towards becoming board certified in obesity medicine.
Yeah, yeah. Well, I'd love to hear why you decided to pursue obesity medicine.
Yeah, for sure. So I personally have struggled with the disease of obesity for most of my adult life. And as I became an internal medicine doctor, I had a lot of patients who were struggling with it and looking for guidance and kind of always felt this little bit of like imposter syndrome of like, like the I feel like I should be able to like take care of this on my own for myself, but I can walk patients through it. And as I became an attending and I started right around the time of like after COVID was over, the GLP-1 medication ramping up, and we were seeing a lot of the new indications for treating obesity, and patients just kept asking me about it. And I'm like, I want to learn more about this. So I ended up connecting with a bariatric surgeon in our area and just kind of like he and I came up with a good workflow because he wanted a lot of his post-op patients to see me for med management as well. And then I was like, why don't I like I didn't know that obesity medicine was like its own subspecialty. And he's the one who introduced me to that and just kind of started pursuing that and being able to treat patients. But also I am a bariatric patient myself. And so have also went on the journey with GLP-1s. And so I bring a lot of like lived experience of, yeah, I've experienced these side effects of these meds and here's how I combated that. And I think that being able to relate to patients helps me to be empathetic to obesity as a disease and the struggle and the stigma that comes with it.
Yeah, well, thank you for sharing that. And I think that's such a powerful, I guess, experience that you bring to this patient population that is, really looking for help. And as you said, that many people don't even know that obesity is a specialty, or even that obesity is a disease to be treated. And so, the more awareness that we have, the better. And then for you to have your, like you said, lived experience as well as the medical knowledge to back up your treatment plans that you're creating with your patients is so wonderful. So I'm really glad to have you on my team now.
Thank you. I'm so excited to be here. I am really enjoying being able to help patients.
Mhm. Yeah. One question that I wanted to address that some people might have is the DO versus MD behind our names. So we're both medical doctors. I'm an MD, you're a DO. And I'd love to hear just what the difference and similarities are about these, I guess, training paths.
Yeah, absolutely. So a lot like you would maybe get like the difference in schooling for like a bachelor's of arts degree or a bachelor's of science. There's the same thing with a doctorate degree for medical doctors. So you can go the MD route and become a medical doctor or a DO, which is doctor of osteopathic medicine. Traditionally, osteopathic doctors I mean, there's like a whole history in that. So like I won't dive into all of that. But in general, DOs learn the same curriculum in medical school as MDs do, but there is an added embedded curriculum of osteopathic manipulative treatments. This is something similar to chiropractics. The thought behind if everything in your, like, if your musculoskeletal system is completely aligned, your body has the innate ability to heal itself. And with that comes a lot of like holistic approaches to treatment. So looking more at the root cause of disease, and not just like giving patients pills for, symptoms, but really figuring out why they have symptoms. Not that MDs don't do this, because like they also, it's like an overarching principle of medicine of like finding the root cause. But in my experience, DOs, we are especially equipped with caring for patients. We get a lot of hands-on with the manipulative treatment stuff. So really comfortable with like physical exam things, which is kind of phasing out. And then, oh my gosh, I'm so sorry. My daughter's in the background.
Oh, that's okay.
But yeah, so MDs and DOs get the same amount of schooling, and then you get your training after that in residency. And so traditionally there used to be MD residencies and DO residencies. And really about the time I was graduating medical school, they merged those. So we're all just like accredited through the same residency programs. So my program was actually an MD residency. So I really don't do any of the osteopathic, like manipulative treatment stuff in practice because I just haven't done it since school. But in general, most of us just like take a little more holistic approach and are really better at communicating with the patients about like if they have questions about things that aren't maybe medicine treatments. So we get like a little bit of training and acupuncture and that kind of stuff. Very minimal, but that's like how I would explain it to a patient is we have the same credentials. We're licensed to do the same things, treat, evaluate, prescribe medications. We just get a little extra training in the hands-on stuff.
Yeah, I think that's a great explanation. And a lot of people do get confused when they see that designation. So thank you for taking the time to go over it. And I know in my residency, we had at least one DO faculty. I think it was just one, but she was really passionate about sharing some of that extra knowledge with us. So it
Yeah,
was really interesting to hear from her. Um, and yeah, like you said, the physical exam, for better for worse, is kind of becoming
yeah.
less part of the clinical exam,
Mhm.
but it definitely plays a role, and DOs are really great at that. But I think that philosophy of going back to the underlying cause, the root cause, and focusing on prevention really aligns with my philosophy. And that's why I went
Mhm.
into family medicine and then eventually obesity medicine. So I think that those paths, like you said, can cross over a little bit too.
Absolutely. And there's like kind of each one has their own stereotype. And so I've met MDs that are just as like equipped for those things. They actually do have some postdoc training too. If people want to do osteopathic treatments as MDs, they're allowed to get training in that too. So there's definitely crossover. It's definitely not like either or. And I've met amazing MDs and DOs, and like we all work together as a team really well.
Yeah, yeah, absolutely. Well, I guess on the lines of philosophy, what is your overall treatment philosophy, maybe like in general in your primary care practice, and then specifically with your patients that you treat for obesity?
Absolutely. So, in general, for like primary care patients, so I work at a senior primary care office for like during the day. My biggest thing is um, making sure patients are educated in what all the treatment options are and also giving them a choice because I feel like if we're not giving patients all the options and the risks and benefits of all of those things, then they really truly aren't making an informed decision. And a lot of times, these patients I've seen have their whole lives seen doctors who are like, "Oh, I'm just going to prescribe this medicine for you. You have to take it." And they don't know why they're taking it. And
Mm,
so I really take a more educational approach with my patients. So that's probably the philosophy for like primary care in general is like making sure that the patient and myself know that like we're on the same page with the treatment and that we're okay with moving forward in that way. As far as obesity treatment, my philosophy, first of all, as a person who's experienced this, is really reiterating with patients that, like, this is a chronic disease. This is not your fault. It's not a lack of willpower. This is a disease, and we just need to treat it as such. And so I think that's where a lot of people have come into healthcare with this negative experience in the past because they've been told, well, you just need to exercise more, you need to calorie restrict and eat less, and oh, well, you're just lazy or whatever. And so then they feel like they can't even like talk to their doctor about it.
Mhm.
So I feel like very fortunate when patients bring it up because I'm like, absolutely, this is a piece of your health. And I also like to reiterate with patients that like my goal as your doctor is not to make you skinny, it's to make you healthy. And the number on the scale is just one piece of the puzzle. And so like I'm looking at the whole picture. Let's talk about all of it.
Yeah. Yeah. I align with you so much on both of those approaches. Yeah, I love patient education and allowing patient choice, and then treating obesity like any other chronic medical condition. Um, but I'm curious what your thoughts are on, coming, well, you still do primary care, so doing primary care and then having the opportunity to have like these dedicated visits to focus on obesity and weight management. You've been working here for a month now, so it hasn't been too long, but what has been, I guess, the difference between those two approaches or what you've been able to do in the two different settings?
Absolutely. So the biggest thing I've noticed with having a weight focused visit is that we can take so much more thorough of a history than when we're trying to cover the wide array of things patients come to at a primary care office. Because, like, at my primary care office, I get like 30 minutes with a patient and we got to cover it all. And so when they want to talk weight, I often do have them come back just for a weight focused visit. So we can dive into what is your nutrition like? What is your physical activity like? Where are areas that we can improve things little by little? But it's really difficult to accommodate in a primary care office when you're also managing high blood pressure and heart failure, and we're also doing diabetes, which is part of this metabolic health thing, but sometimes it's like we have other things we gotta talk about with it, and so it's hard to juggle all of that, and so I've been really excited that we have this dedicated time that we can ask really thorough questions, really dive into education with the patients of how can we incorporate little things every day? What are manageable goals that we can set for ourselves? I think that's the big difference is the time and the ability to really focus in.
Yeah, yeah, that's great. Um, what are some of the things that I guess you're hoping to accomplish either with yourself or with patients at Missouri Metabolic Health?
Oh, that's a good question. I don't know that I have a good answer for that. For me, gaining more experience and like flexing that muscle, I guess I should say, of being able to focus in on metabolic health. Because truly, like, I don't know if you experienced this when you first started practicing, but like going into a primary care field, you start to see the things that you enjoy treating. And so when I first started and I was in like a fee for service job seeing like 28 patients a day, and I was like, the patients who came in to talk about weight loss, I always got so excited. I'm like, I can't wait for those visits. I just want to focus on that. So being able to like just do that, I'd love to like ramp up a little bit and really focus in on that as time moves on.
Hmm. I agree. And I definitely leaned in that direction as well. Also with diabetes care, I enjoyed those visits too. And there's so much to learn in obesity medicine and metabolic health. And, we were at the obesity medicine conference together and there were so many different amazing topics. And I mean, it's an annual conference, so we're always going over and learning more and more. So it's an exciting field to be in right now.
Absolutely.
Great. Well, is there anything else that you wanted to share, either about yourself or, again, yeah, your approach and practice, or just obesity in general, as as a budding obesity medicine physician?
I guess so I'll start with something about me. I guess I'll just talk a little bit about my journey to start with
Mhm.
because I know like when you come to the doctor, you're not here about me, but you kind of
Mhm.
always want to know what your doctor's gone through. So
Yeah.
I'll just put it out there and then people can refer to it later. But my journey started probably in 2023 with my like weight loss journey. And I started with Wegovy and then switched over to Zepbound about 6 months in. And then last year decided to have bariatric surgery. I had a gastric bypass. And then since then, I've resumed the Zepbound at a lower dose and am using that to help continue on my journey. And during that time, have incorporated so much more movement and nutrition and just learning as much as I can about how to support metabolic health through those things. And so being able to like tell patients, hey, I know this is hard. And like, we're not gonna, like, Rome wasn't built in a day, right? So,
Mhm.
like, little by little, we've done these things and I have too. So I want to like encourage patients that it may seem like such a huge hurdle to jump over, but like we're here to partner with you and to go every little step of the way. And that finding I think another thing is super important is finding a physician who's comfortable managing these medications and the side effects and really specializing in that is super important because I've heard so many stories of primary care doctors who are prescribing these medications with like little to no follow up. And it can be like really hard on patients. There's not a lot of support. And then people go to places that are maybe not as credible for that information. So, I'm just really excited to be able to work with you and to gain all that experience and kind of add to the world of obesity medicine.
Mhm. Well, we're so lucky to have you. And you're right, it is really important. And there are proven better outcomes when you are working with a obesity medicine specialist and somebody who's partnering with you along the way. And it is a journey, and it's probably going to be a combination of treatments, and that may change over time. And so you need to find somebody who you can be honest with and vulnerable with, and share what's really happening with you, because that's how we as physicians make decisions or make recommendations, is based off of what you share with us. And so you do have to have that trusting relationship, as the foundation.
Absolutely. I guess to that point also, like building your team can look like even adding in other people like dietitians and therapists or counselors. And, you can also get like fitness involved if you want to get a personal trainer. And I'm a huge proponent for like building a team for your own health. And that's like a big way to invest in your health moving forward, holding you accountable. So like we get to be part of that team, but it's not just us, like, there are other people out there that can help too.
hmm Absolutely. And that also makes me think of social media, because that's ultimately how we met each other, was on
Yeah,
TikTok, back over a year ago. And so I definitely want to highlight that, you know, y- you could follow Dr. Brianna Bingham on TikTok. What is your
it's
handle?
just
And
Brianna Bingham DO on all
okay.
platforms. That's my name on TikTok and Instagram and Facebook.
hmm
But yeah, that's how we met, and I've connected with so many people on TikTok in the obesity medicine realm, and it's been amazing to make connections and meet some of the people in person at OMA this year, which was awesome, and
Yeah.
the world
Yeah.
is a
It's
smaller place because of social media.
Yeah, there can be a lot of, bad information, a lot of noise out there, but if you follow the right people, it kind of filters out those the other noise.
Yeah,
Um,
exactly.
yes, yes. So definitely recommend. I'll make sure that your handle and links are included in this, so people can find you and know that they're getting reliable information. Both some medical knowledge, not direct medical advice, but medical knowledge,
Exactly.
and examples of the things that you're doing. Because I know you share, your journey and your story there as well. And so again, that's so powerful for people, especially if they don't have access to this type of care, the specialty care. You can get really great information and ideas and support and community online.
Absolutely.
Well, great. Well, thank you so much for taking the time. If anyone wanted to become your patient, where should they look for you?
Well, they should look for me at Missouri Metabolic Health and schedule with me. As of right now, my availability is fairly limited, but I see that opening up a little more as we get into the summer. So
Mhm.
I'm excited about that. Yeah, check us out online and you can schedule with me there.
Perfect. Well, I'm so excited to have you. Thanks for coming on the podcast, and we should definitely do this again.
Yes, thank you so much, Dr. Ogle.